And now it's a pleasure to introduce Dr. Robert Bright. He's an assistant professor of psychiatry here at Mayo Clinic in Scottsdale. He did his undergrad at the Medical School, University of North Carolina, and his residency at the University of California, San Francisco. And just being around him makes you feel well as a physician. So thank you.
That's very kind. Thank you, Carolyn. Welcome, everybody, to Arizona. I hope you're enjoying our beautiful spring and the beautiful Monte Lucia Resort. It's my pleasure to be here this morning, and I'd like to thank the course directors for inviting me. And the topic this morning is physician wellness. I have no conflict of interest with this, I guess, and no disclosures. So when I was a fourth-year medical student, I got a gun. I didn't go to a gun store. I didn't go to a pawn shop. I didn't go to a gun fair. I didn't steal it. I didn't get it for a friend. One of my best friends and colleagues gave it to me because she was going to commit suicide, and she wanted my help in not doing that. She was under psychiatric care, and I was peripherally in touch with her psychiatrist. I was headed towards psychiatry myself. I was in close contact with one of our deans who was a psychiatrist. She never knew who the student was, but between the two of us, we were able to negotiate and navigate that difficult time. My friend had borrowed her gun from a friend for self-protection, which was just the opposite of what she intended. And eventually she got better, was no longer suicidal, and we were able to get the gun back to the original source. How are you guys doing this morning? Doing okay? That's what we say, right? But how often is it this? And it's a social okay, and we hide the broken part, and we don't reveal what's really going on. Physician wellness. What does it mean to be well? Does it mean you're not complaining? Does it mean you don't have any complaints? Does it mean you're smiling? That you have good patient satisfaction scores? That you're productive and the numbers look good? What's your hospital system's definition of wellness? Perhaps it's some of those things I just mentioned. What's society's definition of physician wellness? What do your patients think?